Hello everyone, I'm Dr. Tanmeet Oberoi. I'm a physiotherapist, and in this video I'll talk about some special tests for shoulder. This video is specially for my fellow physiotherapists. They can apply these tests on the patient who is having a shoulder pain. So I'll talk about many shoulder tests. So let's go. So the first test that we'll talk about is for supraspinatus tendon tear, that is empty can test. In this test, the starting position of the patient will be shoulder abducted 90 degrees in the scapular plane, and then I'll ask the patient to abduct the shoulder further, and the physiotherapist will resist it. If the patient is feeling pain or discomfort in this motion, then there are chances that the supraspinatus tendon is tear. Okay, so the second test that I'll talk about is lift off test. This test is for subscapular muscle tear, tendon tear. So in this test, the starting position of the patient will be the hand is behind the shoulder, internally rotated and adducted. So then I'll lift the shoulder off his back, and then I'll ask the patient to hold their hand in this position. I'll ask the patient to hold his hand in this position. If the patient is unable to hold his hand in the lift off position, then there are chances that the patient's subscapular tendon is tear. So the third test that I'll talk about is the external rotation test. This is for the infraspinatus tendon tear. So the starting position of this test will be the elbows 90 degree flexed, and then from here I'll ask the patient to externally rotate the arm, and the physiotherapist will resist it. So now if the patient is feeling any pain or discomfort in this motion, then there are chances that the infraspinatus tendon is tear. So the fourth test that I'll talk about is drop arm test. In this test, we'll look at the whole rotator cuff tear. So in this rotator cuff, there are four main muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. So I have talked about separately all of these muscles. Now I am talking about the whole rotator cuff tear. In this test, the starting position of the patient will be the arm is abducted by the therapist till 90 degree, and then I'll ask the patient to slowly adduct your arms as slow as possible till the end. If the patient is not able to do this motion slowly and suddenly do this motion, or is feeling pain while doing it, then there are chances that the rotator cuff muscles are tear. Okay, so the fifth test that I'll talk about is specifically for frozen shoulder. So in this test, I'll ask the patient to do some movements that are very painful or very difficult in the cases of frozen shoulder. In the cases of frozen shoulder, the most difficult movement is the external rotation, then is the abduction, then is the internal rotation, and then is the adduction. So in this test, all of these movements I'll ask the patient to do, and then we'll see if the patient is feeling any pain or discomfort. So in this test, the starting position of the patient will be at the back, and this will be the position of the patient. In this position, the shoulder is abducted and externally rotated. If the patient is feeling pain, then there are chances that the patient is having frozen shoulder. The second movement is from the back downwards. In this movement, we are asking the patient to do adduction and internal rotation. So if any of this movement, the patient is feeling any pain or discomfort, there are chances that there is a frozen shoulder. The sixth test that I'll talk about is for the subacromial impingement of the shoulder joint. This test is called Hawkins Kennedy test. In this test, the starting position of the patient is the sitting position, and the shoulder will be 90-degree flexed, and the elbow will also be 90-degree flexed. The therapist will put their hand like this, and then I'll internally rotate the patient's arm. If the patient is feeling any pain or discomfort, then there are chances, and it indicates that the patient is having a subacromial impingement. Now, the seventh test is also for subacromial impingement, and this test is called Neer's impingement test. As the name suggests, it is the test for the impingement of the subacromial joint. And in this test, the patient will also be in a sitting position, and then the physiotherapist will flex the patient arm from here till 90-degree in pronated arm, passively. We can go up till the 180-degree. If the patient is feeling any pain or restriction or discomfort in this motion, then it indicates that there is a subacromial impingement in the joint. So, eighth test that I'll show you is called the Speed's test. It is specifically for biceps tendinitis, the long head of the biceps tendinitis. In this test, the starting position of the patient will be in sitting position, and then the physiotherapist will palpate the long head of the bicep tendon, that is at the groove of the shoulder. And in this, first you will palpate it, and then you will flex the patient's shoulder. If the patient is feeling any pain, then the test is positive. If not, then I'll ask the patient to supinate the arm. And if this movement is also painful or restricted, then there are chances that the biceps tendinitis is there. Okay, so the last test that I'll talk about is the wall push-up test. In this test, I'll look for the scapular instability. So the starting position of the patient will be facing the wall, and the patient will do wall push-ups. And as a physiotherapist, I'll note about the winging of the scapula. Do wall push-ups. Continuous. This. So if there is a winging of scapula in this wall push-ups, then it indicates that the there is scapular instability in the joint. So that's it. I'll stop this video now. Okay, so that's it. I've talked about many special tests for the shoulder in this video. You can share this video with your fellow physiotherapists, anyone who need this, and I'll continue to make these videos. You can share, like and subscribe our channel Charan Kamal Health Group for further more videos like this. Thank you.